Multiple sclerosis has a reputation for being difficult to diagnose. I think probably now that's not really warranted, so most people can be diagnosed pretty straightforwardly. However, there are situations where it can be tricky. So to give some examples, I've said that 90% of people with MS have oligoclonal bands in their spinal fluid, and that's why we do lumbar punctures. But of course that does leave 10% or so who don't. MRI scans are really useful early on in young people, but as people get older they become less and less discriminating because people have other blobs on their brains for other reasons. So an older person who presents with symptoms that might be MS, now that can be tricky. And then, as people with MS will know, there are some symptoms that are very real but are very hard to quantify, and fatigue is an especially true one of them. So some people may go for many years with fatigue that eventually is attributed to MS, but it's so non-specific that people just don't recognize it for what it is. I think GPs are good gatekeepers of working out whether something is worth taking forward or not usually, so I would always listen to what your GP said and have trust in them. But if there's that anxiety lurking behind you all the time, perhaps because someone in your family has had MS or you've met someone with MS and this all rings true for you, then I think I would say that to the GP. Look, you know, I have a real concern that I might have MS because of this, that or other. And a good GP will take that seriously and refer on to a neurologist. And I see people quite a lot who are worried for good reasons that they might have MS, and yet if you just talk to them alone, probably there's not much to go for it. And in that context I would arrange a scan, an MRI scan, because it's pretty definitive in a young person. And if that's normal, I would say that's that. And I think that is a good use of resources, because if you diagnose MS, then you're going to be able to treat that person and prevent disability. If you diagnose that they don't have MS confidently, then hopefully you'll relieve a lot of anxiety, not just for the moment, but for decades. People can be anxious if it's not addressed early on.